Hello guys, my name is Afif and today I would like to explain about the introduction of artificial intelligence in healthcare. So as we all know, healthcare, AI is getting much more popular nowadays as it's widely being used in economics, society and even business. So nowadays it is starting to be implemented in healthcare. So why implement AI in healthcare? So as we all know, humans have limitations, and of course doctors and even nurses cannot work 24 hours a day, and they also need rest. So having a machine having an artificial intelligence to help them out, to support them to make critical decisions, calculations, and even identifying illness can really speed the process up and help them in a lot of ways. So for example, having an expert system of identifying what kind of illness that person have can significantly save time for doctors, because they would skip the part where they need to interview the patient on what kind of symptoms that they have and all. So they can just straight away look at the reports that is being processed by the expert system, and they just can straight away determine the most probability of the person have that kind of illness, and just straight away to diagnosis or treatment. So not only that, even AI can help to determine what kind of medicine that this person needs, and even what kind of alternative of treatment that the person can undergo. So all these kinds of critical decision and calculations that is being done by expert system can significantly help those people in health sectors, especially doctors and nurses. So for example, nowadays with the pandemic that is going on worldwide, having a very essential or having a very supportive expert system really helps the frontliners in reducing the amount of patient. Even though it's proven that AI can surpass the limitation of humans, in a lot of things such as calculations and even determining the kind of symptoms, the kind of illness that the person have. The fully automation of AI in healthcare is still being discussed, since it involves ethics and delegation issues, because it relates to life and death scenarios.
Coronavirus, or COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with this virus will face mild to moderate respiratory illness. There is no cure yet to be found, and those with underlying medical problems like diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness, as well as older people. This virus spreads through droplets of saliva or discharge from the nose, which are from sneezing and coughing. Hospitals have leaned on AI to help them more quickly diagnose suspected cases. AI has been deployed to detect visual signs of pneumonia associated with COVID-19 on images from lung CT scans. Though the AI technology alone cannot confirm cases of COVID-19, it does help reduce the burden on healthcare providers and direct limited resources by identifying the likeliest cases.
Okay, so moving on, how AI helps to track coronavirus. So there are actually three things, which are prediction, detection, and actions. So the first one is prediction. So this is not the first time that a virus originated from animals. Back then, Ebola also came from bats. So by having essential information such as the population of animal and what kind of food that the people at that particular location are eating, can help to identify potential location that the virus could emerge from, which helps the local authorities to prevent to spread awareness and practice social distances, and even take to help to sanitize things that they have in order to prevent the coronavirus from spreading. So the next one is social media. So the data mining of social media also helps in preventing coronavirus from spreading, since it helps the health experts to make predictions based on real data, so in order to help them in make preparations of having the enough medical supplies and food supplies, and even help the government to determine the best economic strategy in order to keep the country going. So it's proven that AI helps in a lot of ways in tracking the coronavirus.
The third role of AI in dealing with the pandemic is to sterilize and clean. To deal with the COVID-19, crowded
UV
places,
disinfection
especially
robot.
hospitals, must be avoided. But for the healthcare workers and patients themselves, there's no other option. For example, for doctors and nurses, close contact with their patients is essential, which may lead to the spread of the virus. Therefore, to combat the COVID-19, a Danish company known as Blue Ocean Robotics has invented an autonomous mobile robot called UVD robot. These robots use 8 UVC lights that emit enough energy to break down the DNA of any microorganism. It can enter a room and disinfect it without exposing the people present to potentially harmful radiation. This video shows how the UVD robots work. First of all, the cleaning staff gives the order to the UVD robot via specific applications where they have to choose which room to disinfect. Then, the robot makes its way to the room, and when the robot arrives at the room, a thorough check must be carried out by the cleaning staff. It takes only between 10 to 15 minutes, and it will notify the staff when it's done. Finally, a report is made and the robot leaves. For your information, these self-driving Danish disinfection robots were shipped to more than 2,000 hospitals in China to help fight the COVID-19 outbreak. The third role of AI in dealing with the pandemic.
So last but not least, artificial intelligence also plays an important role in treating patients during this coronavirus outbreak. For example, AI can develop and program robots that can be used in hospital. So instead of nurses and medical staff doing the treating patients things, they can just use the robots instead to avoid to keep a distance and avoid direct contact with the infected patients. So the idea of using robots actually could prevent the nurses and any medical staffs from getting infected by the virus, and also it can reduce the spread of the virus. So the robots will be able to check on the patients, like checking their temperatures, their vital signs. They can also deliver their meals and medicines and monitor the patients, which the robots will send the data to the doctors, and the doctors will interpret the data to know the conditions of the patients from time to time. Other than that, by using the robots, actually could save a lot of medical stuffs like protective masks and gowns, which we call it PPE, I think. You know that the shortage of masks and gowns will be the biggest problem at this moment. So robots actually are useful during this outbreak. It may cost an arm and a leg, but it is useful for the sake of saving the world. So that's all.